Hypertension is when the pressure in one's blood vessels is too high. It is common but can be serious if not treated. People with hypertension in Nakaseke district have less worries since the medication is at only 5,000 Ugandan shillings through Mopuleesa, a digital savings scheme.
But I
brought this opportunity to save funds so that we have continuous supply of drugs. The fact is I've got the medication for 2 months, and in those 2 months, my pressure has drastically decreased.
Today, researchers have been in the district at the African Community Center for Social Sustainability Access, witnessing how this particular project operates. These were first taken around Access to see what else is done at the organization.
So it's considered the health center 3. 2. You may find it
still now it's still 2. But we are hoping to go to 3.
After the tour, the innovators of Mopuleesa took center to elaborate every detail of this particular mobile app and the progress made so far.
In 2016, we had a self-reported study whereby we screened over 16,000 participants in Nakaseke, and were able to actually report about their status, about NCDs that time around. And we did a screening within the community, and within the same period of time, we went ahead and established 3 clinics.
They can save in 1 day or 1 week, they can save 1,000 shilling, and then another 1,000 shilling a week later. And at the end of the month, if on this personal account, at least 5,000 shilling are available in total, these 5,000 shillings are automatically deducted to go into this pooled account. So it does not require clients to transfer 5,000 shilling all at once to the pooled account, but they can save over a longer period of time.
We give a lot of insights on actually how much it costs for someone to afford hypertensive medications. But you find that actually the range, the amount at which these people are receiving medication is way low than the amount they used to use to buy medications.
Here I have successful contributions, then those that failed, then those that didn't have funds on the phone.
There were reactions and recommendations from the researchers to further develop the project.
We need to do a lot of explanation to these clients, especially when they come expecting the drugs, but they don't get the drugs just because they are healthy. You have controlled their pressure, they are healthy, but they will definitely will not understand you.
How can we make sure that these people that have stabilized continue contributing? Because we needed to educate them.
Dr. Gerald, the Assistant Commissioner on Non-Communicable Diseases, Prevention and Control at the Ministry of Health, who was also the guest of honor, commended the project and advised the innovators to include patients in funds management.
For us at the Ministry, we offer the guidance that actually patients can contribute for their care. What you are doing is okay, so long as the management is by patients, which is unlike here. Then the management of the funds should be by patients, but advised by health workers. I think that can solve the problem of you are charging patients in our public health facility. Let's be protected, forewarned. Otherwise, if we continue the way the study was going, we may run into trouble.
Even though the government is providing drugs, it is important, according to Dr. Gerald, for patients to contribute to their health.
We are looking for innovative ways of making sure that our poor people still get treatment, even when our drug budget is not enough. And one way is for patients to contribute to the treatment. But you know, the policy says that government gives free treatment. But we have found out that it's not possible. Patients need to contribute. But how? We must have innovative ways of them contributing so that they are not hurt, but also government continues to contribute also.
Dr. Robert Subula, the President African Community Center for Social Sustainability Access, explained how helpful this initiative is to the locals. He also highlighted what their role is at Access to the community.
Access is African Community Center for Social Sustainability. It was started with a vision of helping people through education, economic empowerment, and health to create a sustainable development that is owned by the entire community. And today we are focusing on Mopuleesa, which is a project that is aimed at increasing accessibility to drug therapy to the people who already have the disease.
I'm so glad for Access, for the provisions they are providing in Nakaseke district, and their target is really a blessing to our people, because those services goes direct to our consumers, which is the community.
People, they are now getting their drugs from the Access, from the Semuto Health Center, because of the support they get from Access. And I'm very happy with the program they have brought, this saving scheme